Good afternoon, Mr. Chairman, Representative Takano, Ranking Member, and members of the committee. I'm very pleased to be here today to talk about GAO's work regarding the Veterans Administration. The VA is filled with talented people dedicated to their noble mission of serving our veterans. However, they work in an unwieldy, highly decentralized organization where efforts to bring about positive change are extremely difficult to happen. In fact, many initiatives to make improvements result in little, if any, meaningful change within the department. As a result of observing this over a number of years, I added a number of VA areas to a list we keep for the Congress of what we consider to be high-risk programs and activities. These are programs where there's waste, mismanagement, or a need of broad-based transformation. So we've added veterans health care, the acquisition management area, and disability exams to this area. Now, in the healthcare area, there are a number of things we pointed out. First, there's a need for better standards and measures to ensure timely access of veterans to the care that they need. Also, in the mental health and behavioral health area, more analysis to provide services targeted to veterans in need of intensive medical health services could be improved, particularly for rural veterans. Also, efforts to integrate behavioral health care into primary health services, which is one of VA's strategies, has been hampered by a lack of staff shortages, and more attention needs to be put in that area. Also, oversight of long-term care facilities needs to be improved, both in the oversight of state nursing homes that VA provides funds to, as well as VA's own community living centers. There also needs to be greater attention to ensure there are enough providers in the networks to provide care, and also that ineligible providers are rooted out and not allowed to provide care in the system, and that employees really pass the background screening investigations that they must pass in order to ensure the care of veterans and protect our veterans. And also, as Mr. Missel mentioned, there's a need for a much more disciplined management practice to ensure the effective implementation of the electronic healthcare record system. Now, in the acquisition management area, there needs to be better strategies to purchase medical and surgical supplies in a much more efficient manner than there has been. There needs to be attention to supply chain management, so not only what's purchased, but how it's managed to get to the right places at the right time, and also to make sure you have an adequate workforce in the acquisition area that's trained and competent to carry out their responsibilities to provide the support necessary to give medical care to our veterans. In the disability exams area, this is one of longstanding concerns. We're still using at the Veterans Department, medical criteria and earnings loss information based on a 1940s model. This needs to be improved. VA's been working on it. They're 8 years behind schedule, and while there have been studies, there haven't been improvements to the system. Also, there's a big backlog. There's about 80,000 cases from their legacy appeals process, which on average is taking 7 years to render an appeal. There's a 380,000 backlog in appeals under the new 5-option appeals process that they have. So as a result of these legacy issues, they're not as well positioned as I believe they need to be and could be in order to implement the PACT Act. Now, that's going to be a heavy lift for them, and they need to learn from some of these past areas where they're not applying best management practices to effectuate a good, efficient disability system that ensures timely processing of original claims as well as the appeals process going forward. So we are dedicated at GAO to working with the Inspector General, with the Veterans Department. I've noticed some improvement lately in our efforts to get agreement of what needs to be done with the department, so I see some glimmers of progress, but that's only the beginning, and there's a long way necessary to really bring about the type of change that our veterans deserve. So I'd be happy to answer questions at the appropriate point.